There's more evidence from the UK that coronavirus poses a greater risk to people from ethnic minorities. Men from South Asian and black backgrounds have an increased chance of dying from the virus when compared to white males.
My father, he was very simple, very religious man.
Every day for 2 months, Mohammed has mourned his father's passing. Ilyas Patel was just 60 when COVID took him.
Even though I've grown up, I've got my own family, still I get phone calls all the time, are you okay? How are the kids?
As someone from Britain's South Asian community, Ilyas was most at risk of dying from COVID-19 in hospital. A risk calculated at 19% higher than the white community, according to researchers from Edinburgh University. That news will be badly received here in Leicester. This city is home to one of Britain's most diverse communities. And it's here where Health Secretary Matt Hancock has identified a fresh outbreak of COVID-19. We don't know if this outbreak has a direct link to Leicester's South Asian community, but we do know that COVID-19 affects South Asians more than it affects other communities in this country. They'll be watching what happens here very nervously. One of the reasons for black, Asian and minority ethnic communities being disproportionately affected by COVID is the high prevalence of diabetes and other underlying conditions.
A big problem is obesity, and a lot of these patients don't exercise, particularly the women. There aren't programs as such which are culturally and in terms of language isn't appropriate for them to go and join.
The Office for National Statistics has now published new figures on COVID-19 deaths by ethnicity, and they show black males are twice as likely to die from coronavirus, and South Asians more than 1.5 times as likely to die. A grim statistic that has resonated with these Black Lives Matter protesters in Birmingham.
It's racism from the perspective that no one has taken the health inequalities that we suffer as an African Caribbean community seriously.
We are still learning about the why, but have identified who is at most risk. And for Britain's black and Asian communities, this health disparity is another inequality that must be addressed before more lives are lost. Ashish Joshi, Sky News,